Removal of intrauterine device, IUD. To remove a previously placed IUD from the uterus, a device is inserted through the cervical os and used to grasp and remove the IUD. Removal of all components of a multi-component, inflatable penile prosthesis without replacement of prosthesis. The patient is taken to the operating room, placed in a supine or lithotomy position, and the physician makes an incision using the same penoscrotal or infrapubic approach as the original procedure to remove the multi-component, inflatable penile prosthesis. The physician makes an incision into the corpus cavernosum and the prosthesis is withdrawn. The corporotomy is closed by suture. The subcutaneous tissue is closed by suture and a dressing is applied to the incision. The bladder is emptied with a catheter. An indwelling urethral catheter, if used, is removed on the first postoperative day. Removal of non-inflatable, semi-rigid, or inflatable, self-contained, penile prosthesis, without replacement of prosthesis. The physician makes an incision using the same approach, i.e., penoscrotal or distal penile, as the original procedure to remove the non-inflatable or self-contained inflatable penile prosthesis in a patient who is under general anesthesia. An incision is made into the corpus cavernosum, the corporal tissue is dissected, and the prosthesis is removed from the corporal body. The wound is irrigated with antibiotics, and the corporotomy is closed by suture. The subcutaneous tissue is closed by suture and a dressing is applied to the incision. The bladder is emptied with a catheter. Removal or repair of electromagnetic bone conduction hearing device in temporal bone. Through a post-auricular incision, the physician accesses a previously implanted electromagnetic bone conduction hearing device. The device is repaired or removed. The wound is irrigated and repaired with sutures. A dressing is applied. Removal impacted cerumen requiring instrumentation. Under direct visualization, the physician removes impacted cerumen, ear wax, using suction, a cerumen spoon or delicate forceps. If no infection is present, the ear canal may be irrigated. Removal of tongs or halo applied by another individual. The physician removes tongs or a halo applied by another physician. Maintaining alignment of the cervical spine, the physician unscrews the frame pins from the skull and removes the tongs or halo. Bone wax may be applied to the wounds to promote healing of the skull. Dressing may be applied to the skin wounds and the skin may be sutured. Removal, under anesthesia, of external fixation system. The physician removes the external fixation frame and pulls pins out manually while the patient is under anesthesia. Incisions are closed with sutures and stri strips. Removal of implant, superficial, e.g., buried wire, pin or rod. The physician makes a small incision overlying the site of the implant. The implant is located. The physician removes the implant by pulling or unscrewing it. The incision is closed with sutures and slash or stri strips. Removal of implant, deep, e.g., buried wire, pin, screw, metal band, nail, rod or plate. The physician makes an incision overlying the site of the implant. Deep dissection is carried down to visualize the implant, which is usually below the muscle level and within bone. The physician uses instruments to remove the implant from the bone. The incision is repaired in layers using sutures, staples, and slash or stri strips. Removal of tumor, temporal bone. A vertical incision is made just anterior to the auricle and is extended superiorly to expose the temporalis muscle. The muscle is divided. A section of the skull, craniotomy, is removed to expose the dura over the temporal lobe of the brain. The dura is elevated off the floor of the middle fossa. The physician isolates and dissects a tumor of the temporal bone. The internal auditory canal may be decompressed. A muscle graft is placed over the internal auditory canal. The bone plug is returned to the skull, the incision is sutured, and a dressing is applied. Removal of bone flap or prosthetic plate of skull. The physician removes a bone flap or prosthetic plate of the skull. The physician incises the scalp above the area to be resected and retracts it. The stabilizers are removed and the bone flap lifted. The scalp is reproximate over the dura and sutured in layers. Removal of subdeltoid calcareous deposits, open. The physician removes subdeltoid calcareous deposits by making a small incision over the deltoid muscle to expose the rotator cuff tendons. The raised area over the calcium deposits is incised in line with the axis of the fibers and the calcareous deposits are removed. A large cavity is made in the tendon with a curette to remove all damaged tissue. The opening is closed with side-to-side sutures. Once the tendon is repaired, the skin incision is closed and a soft dressing is applied.